You should know insurance as a patient. Common plan types. Among the various types of health insurance plans, a health maintenance organization, HMO, stands out for its typically lower monthly costs and deductibles. However, this often comes with the requirement of selecting a primary care physician (PCP) within the network. Should you need to consult a specialist, a referral from your PCP is frequently necessary. Be aware that out-of-network care is generally not covered, with the exception of emergencies. For those desiring greater flexibility in their choice of medical professionals, including specialists and providers outside the network, a preferred provider organization (PPO) offers more freedom, often without the need for referrals. This flexibility, however, usually entails higher costs for out-of-network services. PPOs typically come with higher monthly premiums and may also include deductibles. An exclusive provider organization (EPO) presents a network of chosen providers, much like an HMO, yet often with a broader selection. As with an HMO, out-of-network care is generally not covered, except in urgent situations. The requirement for referrals may or may not apply, and premiums typically fall between those of an HMO and a PPO. A point-of service plan (POs) blends characteristics of both HMOs and PPOs. You'll find that using in-network providers is more economical, and a PCP referral may be required for specialists. While you do have the option to seek care out-of-network, you will incur higher costs and may be responsible for filing your own claims. Finally, a high-deductible health plan (HDHP) is distinguished by its lower monthly premiums paired with higher deductibles. These plans can be coupled with a health savings account (HSA), offering a tax-advantaged way to save and pay for medical expenses. The specific network regulations, whether HMO, PPO, EPO, or POS, will depend on the individual HDHP. Now, let us delve into the meaning of each tier of insurance plans. What does each tier mean? Catastrophic plans bear the lowest monthly premiums, but, in exchange, present very high deductibles and out-of-pocket costs. They are crafted to shield individuals, typically those under the age of 30, or those with a recognized financial hardship exemption from the substantial expenses of severe injury or illness. Importantly, these plans cover essential health benefits, including preventive services and a limited number of primary care visits annually, even before the deductible has been met. Bronze plans generally boast the lowest monthly premiums among the standard metal levels, yet they demand the highest out-of-pocket costs for care. They are often well-suited for individuals and families who enjoy good health and do not anticipate requiring extensive medical services throughout the year. Bronze plans are mandated to cover essential health benefits, and you will be responsible for a higher percentage of covered medical expenses, traditionally around 40%. Silver plans strike a balance between monthly premiums and out-of-pocket costs, making them a popular choice for many. They offer a greater percentage of cost sharing with the insurer, compared to bronze plans traditionally around 30%. Moreover, silver plans are unique as the only metal tier that may grant access to cost-sharing reductions, or CSRs, in addition to premium tax subsidies, both of which can significantly lower out-of-pocket costs for those who qualify based on income. Gold plans, while carrying higher monthly premiums than their silver counterparts, offer lower out-of-pocket costs for care, traditionally around 20% of covered medical expenses. These plans are often ideal for individuals and families who anticipate needing frequent medical services and desire their insurer to bear a larger share of the cost for their care. At the pinnacle, platinum plans command the highest monthly premiums, yet in return, they offer the lowest out-of-pocket costs, traditionally around 10% of covered medical expenses. These plans are best suited for those who require ongoing medical care and seek more predictable out-of-pocket costs throughout the year. It is paramount to remember that while these metal levels provide a general indication of cost sharing, the precise deductibles, copays, and coinsurance amounts can vary significantly among plans, even within the same metal level. Therefore, it is always advisable to meticulously review the plan documents to fully comprehend your potential out-of-pocket expenses. Finally, to navigate the landscape of insurance plans, it is vital to grasp these key terms. Premium. This refers to the recurring monthly cost paid for your insurance coverage. Deductible. This is the amount you must personally pay out of pocket before your insurance coverage begins to cover your medical care, with the notable exception of preventive care. Copay. A copay is a fixed fee paid at the very moment of service, such as when you visit a doctor. Coinsurance. This represents a percentage of the cost of care that you remain responsible for paying after you have successfully met your deductible. Psychiatric wellness. Your journey, our focus. Contact us at 405-437-0205 or psychiatricwellness.org.